Good morning, ladies and gentlemen. This is Young, a new scientist talk show. Can you imagine one day when you go to hospital, everything is designed for you? You have special doctor, you have special therapy, you have special medications. Well, that's the future of personalized medicine, to treat every patient individually. Also, we have somehow achieved part of it. We are still nowhere near perfect. A new research published on March 2014 have taken us one step further to this ultimate goal of personalized medicine. The research is conducted by a group of international scientists from the United Kingdom, Australia and Kenya in Cambridge, the United Kingdom. They use surface drug sensors to effectively detect the activities of drugs in human blood. Before this study, doctors can only use genetic methods to estimate the activity of drugs in patients and apply skin tests for allergic responses. These methods are slow and ineffective. With the help of this new research, doctors are now possible to detect almost directly and instantly the activity of drugs in human blood by surface drug sensors and apply more accurate amount of medicines for different patients to minimize side effects. In this study, researchers used nanochemical cantilevers to detect interaction of ligand receptors in the blood. Now please welcome our special guest today, Dr. Matthew Cooper. Hello, Professor. Just out of curiosity, how does the nanochemical cantilever do? Well, the mechanism is actually quite simple. The nanochemical cantilever is similar to a normal cantilever but in nano size. The cantilever will bend according to the positional change of molecules on them. By measuring their bending deflections optically or electronically, we can determine the stress change of the receptors. So what's the major findings of this experiment? We find out that the weak competing ligands can only influence the drug activity at relative high concentration, which means normal level of weak ligands in blood won't influence the drug activity. We also find that the measurement of our nanochemical cantilever are 30 times more accurate than previous approaches. In general, this experiment studied the influence of weak and strong competing ligands on drug functions. Why is this experiment so important? The experiment combines chemistry and biology and uses chemical theories to complement the omitted area in biology. It is the first published study solving pharmaceutical problems with nanomechanics. It opens a new area of researching to use nanochemistry to tackle biological or medical problems from a molecular level. It also provides a new possible for medical practitioners to accurately monitor drug activities in patients and provide proper dosage. Thank you, Professor. An evolution in medicine is coming based on this research. Doctors will be able to minimize drug dosage and avoid as much side effects as possible to patients. A huge amount of medicine can therefore be saved, which means more patients will be able to certain effective treatments and reduce the cost in medicines. The drug development process will also be accelerated as the drug activity test is more accurate and the risks for human trials are decreased. That's all for today's show. Thank you.